My son's medical emergency happened in America in 2012, and I was fortunate to be able to pay for medical services, as I'm aware that many Americans cannot. Imagine your child ill, your loved one needing urgent treatment, and you can't even seek help. Or alternatively, that you do get medical help, and now you're spending the rest of your life in distress and duress trying to work out how to pay that treatment off. This is every human being's first entitlement, a right to life. All lives are entitled to care, irrespective of what any government mandates or states otherwise. Medical care comes with its own warnings, as death by medical treatment estimates in the US alone range between 85,000 to 195,000 per year. That's a whirlpool of suffering that's not abating. Modern medicine at times is a negation of health. It serves more as an institution of sickness, and many more are made ill than are healed. So today, I choose to be a champion of medical innovation. My dream and my vision, and for now intention, is to make these same effective, drugless practices commonplace. That awareness and understanding is taught at every level within the myriad of healthcare services and providers of what is currently available, and most importantly, successful in treatment, with no reliance on drugs or medication. The creed, "Do no harm," has been oftentimes overlooked today in medical practice by well-intentioned and well-meaning individuals, only through lack of awareness and understanding that there is more, and that the current esteemed body of medical knowledge is finite and very limited, estimated at around 5%, and is still reliant on the unknown factors of how each patient treated will respond for recovery. So today's new advances in technologies, utilising IT for research, identification and futuristically application, is inestimable. It's us as active participants and the senior physicians in our own healthcare who will be the pioneers and trailblazers for transforming the world and current medical practices. So imagine having at the touch of a button, in the convenience of your own home or space, the ability to just plug into your own healing. No medicine with side effects, with warnings as dire as possible death, heart attack, stroke, or a myriad of other painful conditions, almost as bad or sometimes worse than whatever you've been diagnosed with. The only side effect of these drugless interventions, at worst case scenario, is hope and optimism, which has a plethora of scientific studies validating the beneficial aspects of both as an aid to healing and well-being. And on the best case scenario is total recovery. That's win-win. Whatever path or combinations of treatments paths you select is your choice. However, currently this medicineless option is not readily available. My intention, having been in law enforcement as well as investigations for over 16 years combined, with having been a rehabilitation provider to severely or chronically injured people returning to the workplace, is to research, document and film the exact process that has what we call astounding and amazing results, only because it's just not what we're consistently used to with medical practices and treatments. Don't get me wrong, if I have a burst aorta, please rush me to the nearest surgeon. However, most of our health and well-being killers today have the benefit of time on their side. Heart disease, many cancers, obesity, depression, there's a period of time from diagnosis until death. My intention of sharing all that I can prove that exists and is available as effective medicineless treatment, easily and free, is to provide peace and promote you as the master metaphysician in your own healthcare and well-being. There is currently the Master Peng Ning in China, who originally established the medicineless hospital that I mentioned previously, and has still today over 8 million practitioners that I intend to locate in China and, if amenable, interview, and have these medical processes taught on camera to a layperson who in turn can train the trainers, of which all results will be filmed to supply the direct evidence that I intend to present alongside other modalities of which truly encompass that Hippocratic oath of do no harm. Already 3,000 research papers published in the 1990s and over 20 years experimenting has developed it into a scientific system of working with energy to improve quality of life and, most importantly, completely heal without medicine, non-invasive. Secondly, there's been some other innovative research and scientific study undertaken in facilities in San Diego that I also propose to record and provide as full disclosure to you, the human being, of how you can personally and independently become your best, healthiest operational self, free of disease, free of pain, free of suffering. If your own body created the condition, then it's also within the scope of your own body to uncreate the same condition. There's also St. John in Brazil, who is renowned as a healer. He's already been previously featured on Oprah, but I also intend to film this modality of healing. And I need your help to make this happen. This Human Development and Wellbeing Research Initiative needs you. I require supporters and sponsors in order to travel to both locations, China, Brazil, as well as the US, as I'm based in Australia, to film and document and then to edit it into a pitchable format, what we call a sizzle reel, for either Discovery or National Geographic, as they have no fear of going where others fear to tread. I know that proposing a radical change to an outdated medical service and training institution certainly won't be welcome from within, or to those who rely financially on the current status quo. After all, ill health, sickness and death is a lucrative business to many, just as monopoly of communications once was pre-internet and global free access to information and communication. I've worked in extremes of grief and overwhelmment. I've been in tsunami disasters in Indonesia where almost 200,000 lives were lost. The cost in human suffering in our current health system is immeasurable. And the cold-blooded fact that many can't even access medical care is outrageous, inhumane, and unacceptable on any level. No one life is worth more than another, although I'm sure its owner would disagree with me on that one. I choose today to work one-on-one with war veterans and emergency services personnel because I can relate personally with many of the issues, but more importantly, because I have real results that work, mine from real life experience and my own research. Heroes help heroes, and that's what I want now. The heroes out there, either hearing or reading this, who know and feel in their heart that not only what I want to prove is possible, but is true and is what human care and well-being is moving forward to. Non-invasive therapies, low-cost or no-cost treatment. Light, sound, vibration, energy, elemental treatments. I intend to show them all and support them with the evidence from both quantum physics and quantum mechanics that helps to provide some grounding and plausibility to what we see but can't believe, as our current frames of reference are outdated and oftentimes based on false premises. Please share with all those you love and believe can assist. One person does make a difference. So donate now for a cause of compassion, as like me, I'm sure you've lost loved ones or watched them suffer brutally and felt as I once did, helpless. Now we can all do something. Let's get informed and make better choices. Let's teach our children not to accept anything as a fait accompli, rather to challenge, innovate and integrate better practices, especially when your life is at stake. Life is about change, and it's about to radically change. My long-term intention is to create the television series where we all get informed and from many long-standing current viewpoints amazed at what we as human beings are truly capable of with a little help from technology and some ingenuity. In health, the better informed we are means the better choices we can make, and therefore better outcomes result. Heroes help heroes. I've been a hero, now I'm asking you to be, and help me help more.